Welcome back to Medical Monday. We're talking with plastic surgeon Dr. Brian Tierney today, getting all your plastic surgery questions answered without having to go into the doctor just yet. We have Rosalind on the line. Rosalind, thank you for being with us. What's your question?
My question is, well, I'll just say, I'm working on losing weight, and I'm considering having breast reduction and possibly a tummy tuck. And I was wondering, should I wait until I lose a certain amount of weight, or is it something that I should go ahead and do to kind of give me some incentive to continue to lose weight?
You know what? We were just talking about this in the commercial break. I think you bring up a great question. So what is the answer? Should you lose the weight first or not?
Well, she's in a little bit of a dilemma here. So with breast reduction, you have to, for insurance to cover it. Now, it depends if you want insurance to try to cover it or if it's cosmetic. If you want insurance to try to cover it, you have to have more weight to be removed. So actually, losing a lot of weight might bring you out of that.
Right.
But in general, doing tummy tucks or doing any of these surgeries, it's really good to lose weight and go down to about your goal. And then the surgeries will look that much better and they'll last that much longer.
Okay, and when you say goal weight, what do you mean by that? Because I'll just let you explain.
Yeah, so if someone's trying to lose 40 pounds and they're doing well and they get maybe 30 pounds of weight loss and they really can't do that rest, that's pretty close.
Okay.
You could do that surgery and you'll still look really good. You don't have to be at the exact pound that you wanted to be, but it's close enough. But the more weight you lose, the more skin laxity. So for the tummy tuck, you'll be able to pull tighter, you'll be able to remove more skin, you'll be able to remove more fat. So it's really nice to be closer to where you're going to be, because you don't want to do the operation and then lose 20, 30 pounds afterwards and then have some laxity and then wish you had it done.
You're back to square one,
right? It'll still look better, but you still would not be as good as you would ultimately be. So,
so Rosalind's kind of stepping on both sides of the fence there, depending on what she really wants.
True. I would still try to lose weight, get down to where you want to get down to, and you can see a plastic surgeon and see if the breast reduction might be covered by insurance, because it may not anyways. Yeah, so I would see if that is even a consideration.
Okay, Rosalind, I hope that helps you out. Thank you for being part of the show tonight. When insurance covers it mostly, obviously you said it has to do with a weight and a size and a ratio, but what are you hearing from patients about what they're complaining about when they want that reduction?
So when they come in wanting a reduction, it's usually the neck and back pain and shoulder grooving. So they can't work out, they can't run, they can't do a lot of things. Clothes-wise, they don't fit into things that they want to wear.
Yeah.
So it affects everything every day.
Sure.
Just working throughout the day, it gets heavier and heavier and heavier, and it's tough to keep on doing their job. So it's just a life-changing operation to be able to bring them back down into proportion. And sometimes you can remove, 4 or 5 pounds.
Wow.
Which is a lot of weight, because if you put a 4-pound weight around your neck, you're
going to feel it. Quick.
So it's not going to be more than about 20 minutes where you want to get that
Come on, take it off, for sure. Okay, on the tummy tuck, because you said that is your most popular procedure that you do, the most common one that you do. Should people expect to walk away? We talked about the beginning of the show, because I want to talk a little bit about it again in case people are just joining us, but should people expect to walk away with a really toned stomach, like bikini ready?
Eventually, yes. Yeah. Having liposuction and the surgery, within, I'd say, 6 weeks, you're going to be looking really good, be very excited about things, and it's going to be a totally transformation.
Wow. And I guess, can someone be too thin to do one, or is it, what do you
not really. So if you're thin, you might have a lot of extra skin. So pregnancy, you get a lot of extra skin. So I've had tummy tucks where the patient's pretty much all skin, very little fat, still needed the muscle plication to bring in that waist. But very happy, and those are the patients that look good right away.
Yeah. Very interesting. Okay. Why doesn't insurance cover that, though? That's always been my beef with the diastasis recti. Your muscles have ripped apart, and insurance is like, no, that's cosmetic.
Yes.
Yeah. The question probably everybody asks.
That is true. They will not cover a tummy tuck.
Yeah.
There's something called a paniculectomy, which sometimes they will cover if someone's lost a lot of weight. We're talking 50, 100-pound weight loss, and you have what's called almost like an apron, and it goes down low, and it interferes with hygiene. Sometimes the insurance companies can cover that, but even that's pretty rare.
Sure. Really?
Yeah,
It really
pretty
is.
rare,
I mean, you see
yeah.
some of these weight loss shows and you see the dramatic change, but the extra skin that's left over and...
Right. Yeah,
Wow.
the insurance companies try not to pay, is the bottom line.
I guess so. I guess that is the bottom line. You were telling me about some of the other procedures that you do. They may not be the most dramatic or the most popular, but I'm sure the folks who want them see a big difference, like
Right.
the eye issues.
Right. So eyelid surgery is a great surgery to do. That can be done in the office.
Wow.
I could do it in the office under 2 hours easily, where you can come in, have it done, and you can go home. You can even drive your cell phone sometimes.
You're kidding.
It's
Wow.
if you're not taking, because we don't take any Valium or anything like
Yeah.
that. It's just under straight local. So it's a pretty easy recovery. You're gonna have a little pain for maybe a day.
How do you
But-
do it? What happens?
So there's a crease that's in the upper eyelid, and
Right.
you make an incision in that crease and then take the extra skin out. Sometimes there's a little fat that needs to come out as well, but a lot of times it's just a skin operation on the upper lids. And you can just take out the skin and then suture it back together. The sutures come out around 5 to 7 days, and that's it.
And I'm sure the person has a much more refreshed look, awake look.
Much more, yeah. And that's where you focus. When you look at people, you look at their eyes. So for having a surgery done, one surgery, that's going to be a very good result for a pretty minimal type of recovery from a surgery. And it's nice as far as it's not as expensive because it's done in the office. So
What is the expense of something
you're
like that?
looking in the $2,000 range.
And that's something that
$2,500.
should last
So-
a long time, right? I would think.
Oh yeah. So once that skin is gone, it's gone, and it's not going to come back. Well, 7, 10 years, gravity, aging, and all can still affect things, but even so, it's gone, and you should be good for a long time.
You mentioned earlier that a lot of folks are not doing the facelift anymore. It's not that you don't do them, but people are just choosing other things because there are
Right.
other things available. Like what?
So we mentioned a couple already. So the eyelid surgery for the eyes, you have the thermotite for the neck and the lower face, then you have injectables, so you have fillers, and there's all different sorts of things like the Juvederm, things called Sculptra, which is an FDA medication that you could put into the areas that builds collagen. It's more of a natural look. So there's all sorts of different things to kind of bring volume back to the face, because what we kind of found out from like 20 years ago, where it was very popular to remove a lot of fat from the eyes, but they found out that you need that fat as you age.
Sure.
And the same with the face. So it's not about sometimes pulling the skin as tight, it's that you've lost some of that fullness from from fat and volume, so you need to replace that
And that's where you have your
volume.
wrinkles. And,
Right, and that's what brings a wrinkle. So if you could increase that volume either by filler or some sort of sculpture or fat even. So
Sure.
sometimes that's where you could put patient's own fat into the area. You could improve the wrinkles and not have to have a facelift.
That's very interesting. Okay, we have to take one more quick break. We are coming back to wrap things up right after this. Stay with us.